You lean in to say something to your husband, and he turns his head slightly. Not rude, not dramatic. Just a small adjustment, the kind you'd miss if you weren't paying attention. You don't think much of it the first time, or the second. Then you notice your coworker keeps offering you mints. Gum. Want one? Every single day, like clockwork, like it's become a ritual instead of a kindness. You start wondering if she's just generous with candy, or if there's a reason she's doing this specifically with you and not with anyone else at that desk. You brush twice a day. You floss most nights. You've cycled through 3 different mouthwashes in the last 6 months, the kind with the blue label promising all-day freshness, the kind that burns a little, the kind your dentist recommended once, and you never went back for the follow-up. And still, by 2 in the afternoon, that taste creeps back. Metallic, sour, almost like something is breaking down very slowly, somewhere you can't quite locate, somewhere brushing harder doesn't seem to reach. Here's the part that deserves more attention than it usually gets. Breath odor that resists brushing, flossing, mints, and mouthwash is rarely about effort. It's about location. You may be cleaning the wrong place entirely with real discipline for months. Most explanations stop at the tongue and the teeth, because for a huge number of people, that's genuinely where the smell originates. Brush harder, scrape the tongue, it clears up. That logic holds up fine when the source actually lives on the surface. It falls apart completely when the source sits somewhere a toothbrush has never once touched. Underneath the gum line, inside the sinuses, down in the stomach, or carried through the bloodstream itself. Let's start with the layer almost nobody scrapes properly, because it doesn't look like a problem. The back third of your tongue, the part closest to your throat, the part that triggers a gag reflex if you go too far with the toothbrush, collects a thin film made of dead cells, food particles, and bacteria. Under a microscope, it looks almost like a tiny shag carpet, full of grooves and crevices that trap debris the way a doormat traps dirt. Most people clean the front 2/3 of the tongue out of habit and avoid the back third entirely, which means the densest bacterial colony on the entire tongue surface goes almost completely untouched day after day. If you've ever scraped your tongue and been surprised or a little disgusted by the smell that came off the scraper itself, that's not your imagination. That's a fairly accurate preview of what your breath has been carrying all along, just diluted by the time it reaches someone else's nose. A noticeably white or yellowish coating, especially one that doesn't wipe away easily, can also point to an overgrowth of yeast in the mouth, something that becomes more common after a course of antibiotics, with certain inhaled medications for asthma or COPD, or simply with age as the balance of bacteria and fungi in the mouth shifts. That kind of coating tends to carry a distinct, almost bread-like or slightly sour smell, different from the rotten egg quality of gum disease. The texture and color are clues. Most people never look closely enough to notice them. Now, the one that doesn't announce itself with pain, which is exactly why it's dangerous. Gum disease in its early and middle stages is almost completely painless. No throbbing, no obvious bleeding most days. What it produces instead is quieter and in some ways more serious. Small pockets where the gum tissue has pulled slightly away from the tooth, creating a gap your toothbrush cannot physically reach and your floss only grazes the surface of. Inside those pockets, bacteria sit undisturbed for days, sometimes weeks, feeding on tissue and debris. As they break that material down, they release sulfur compounds, hydrogen sulfide, methyl mercaptan, and those compounds are exactly the rotten egg, slightly chemical undertone people describe when they say their breath smells different now, not like before. There's a simple way to get a rough read on this without a dental office at all. Floss one back tooth carefully, then smell the floss itself, not your fingers. If the smell is sharply unpleasant compared to flossing a front tooth, that's a localized signal, not a whole mouth one. And localized smell, especially around back molars, often points toward a deeper pocket than a quick glance in the mirror would ever reveal. Bleeding when you floss isn't a sign you're flossing too hard. It's almost always the opposite, a sign of inflamed tissue that bleeds at the lightest contact, the same inflamed tissue that's hosting the bacteria responsible for the smell. People tend to interpret that bleeding as, "I just need to be gentler," when it's actually the tissue asking for professional attention. There's a structural cause that gets almost no airtime at all: the dental work already sitting in your mouth. Crowns, bridges, and older fillings develop tiny gaps at their margins over years, not because the work was done poorly, but because materials shift slightly and gums recede slightly, and what used to be a tight seal becomes a microscopic ledge where food particles lodge and bacteria settle in permanently. Under a bridge specifically, there's often a small space between the false tooth and the gum that a regular toothbrush can't access at all without a specific tool, a floss threader or a tiny interdental brush. Most people have never been shown how to use. If you have a bridge, a crown, or several older fillings and the smell seems to come from one specific area rather than your whole mouth, that area is worth examining directly, possibly with your dentist's help, rather than assuming it's a general hygiene issue. If any of this is landing differently than you expected, if you're sitting there mentally tracing back to your own bridge, your own back molar, your own tongue you've never really looked at closely, that's worth holding on to, because we're only on the first layer. There's more underneath this, and if you want to keep the thread going instead of losing it in your feed later, this is a natural point to hit subscribe, because the next section moves into territory almost nobody connects to breath at all. Second major layer, and this one sneaks up on people slowly, over years rather than days: dry mouth. Saliva isn't just there for comfort. It's actively antibacterial. It washes debris away, neutralizes acid produced by bacteria, and physically prevents bacterial colonies from establishing a foothold in the first place. As people move through their 50s, 60s, and beyond, salivary gland output can decline, sometimes from blood pressure medications, antihistamines, antidepressants, or diuretics, all of which list dry mouth as a known side effect that almost nobody reads carefully when they're handed a new prescription. Sometimes the decline comes from the glands themselves changing with age, independent of any medication at all. In rarer cases, a persistent, unusually severe dry mouth, especially paired with dry eyes, can point toward an autoimmune condition called Sjögren's syndrome, something worth raising with a doctor specifically if dryness feels disproportionate to anything you're taking. Add a sleep pattern that involves mouth breathing, more common with age, especially if there's any narrowing of the airway at night, any history of snoring, or undiagnosed sleep apnea, and you get a mouth that sits dry for 6, 7, 8 hours straight without a single drop of protective saliva washing through it. Dry tissue is close to ideal breeding ground for anaerobic bacteria, the specific kind responsible for sulfur smell. That's the actual mechanism behind why morning breath for some people has quietly stopped being ordinary morning breath and started being evidence of an environment that no longer resets itself overnight. There's a rough test for this too, simple enough to do tonight. If your mouth feels genuinely dry, not just could use water, but tacky, almost cotton-like, within the first hour of waking, before you've had coffee or anything acidic, that's a reasonably strong sign your saliva production has been suppressed overnight, either by medication, breathing pattern, or both. Now here's where the conversation stops being just about the mouth. Postnasal drip, that thick mucus drainage moving from your sinuses down the back of your throat, carries its own bacteria and its own smell, separate from anything happening at tooth level. People with chronic sinus inflammation, ongoing allergies, or even a structurally narrow nasal passage often describe a breath issue that seems to originate from the back of the throat rather than the front of the mouth, and they're frequently right. You'll notice it especially right after waking or after several days of nasal congestion. Constantly clearing your throat isn't a quirky habit picked up over the years. It's your body actively trying to move that drainage along, and every pass over your tonsils can leave behind small deposits of mucus, bacteria, and debris. Which brings us to something almost nobody talks about directly: tonsil stones, small calcified clusters of debris and bacteria that form inside the natural pockets and folds of your tonsils. They're often tiny, sometimes barely visible without a flashlight and a mirror, but they carry a smell wildly disproportionate to their size. People who've coughed one up by accident are usually genuinely shocked that something that small could be tied to something that strong. If your breath has a sudden sharp unpleasantness that comes and goes rather than sitting there constantly, present for a few days, gone for a week, back again without warning, that on-off pattern is itself a clue, because it tracks almost exactly with how these small deposits form, dislodge, and reform. A throat that occasionally feels like there's a small lump or scratchy sensation on one side, paired with intermittent bad breath, is a combination worth mentioning to a doctor specifically, rather than writing off as just a tickle. Then there's the stomach, and this is the layer that tends to surprise people the most because it feels disconnected from breath entirely until it's explained properly. When stomach acid and partially digested contents travel back up the esophagus, even in small, silent amounts that never register as classic heartburn, they bring a distinct, sour, almost fermented smell along with them. This condition, often called silent reflux or laryngopharyngeal reflux, doesn't always produce the burning sensation people associate with acid reflux. Sometimes the only outward sign is a slightly hoarse voice in the morning, a need to clear the throat repeatedly before speaking, and breath that smells different in quality, not just intensity, sour instead of stale, almost like something fermenting rather than something simply unbrushed. If lying flat shortly after eating makes your throat feel slightly raw the next morning, or makes your breath noticeably worse by the time you wake up, that's not a coincidence worth ignoring. That's a digestive signal, wearing a disguise that has nothing to do with your toothbrush. There's a bacterium connected to this layer that deserves its own mention, because it's both common and almost never discussed in the context of breath. Helicobacter pylori, a bacteria that can live in the lining of the stomach for years, often without symptoms, sometimes linked to chronic indigestion, bloating, or in some people, ulcers down the line. It produces compounds that can carry their own distinct, somewhat sulfuric smell upward through normal digestion and reflux. It's detectable through a simple breath test your doctor can order directly, and if you've had unexplained stomach discomfort alongside breath that doesn't respond to anything dental, that combination is worth raising as a specific possibility, not a vague, "my stomach's been off lately." I want to know something directly, because the pattern in what people describe tells me more than any single symptom on its own. When you read through everything so far, did one specific detail line up with your own experience? The back of tongue coating, the dry mouth in the morning, the sinus drainage, the sour taste after lying down? Drop it in the comments specifically, because the version of this story that matches your life is the one worth tracking down, not the general list. There's a category beyond all of this that moves from uncomfortable into genuinely important, and I'm not going to soften it just to keep things light. A breath that carries a sweet, fruity, almost nail polish remover quality can be associated with very high blood sugar and ketone production, something that shows up in poorly controlled or undiagnosed diabetes. It's distinct enough that once you've smelled it described accurately, it's hard to mistake for anything else. Separately, a breath with an ammonia-like, almost urine-adjacent quality has been associated with kidney function that isn't clearing waste products the way it should, because the body sometimes attempts to eliminate certain compounds through breath when the kidneys are struggling to manage it through urine. And there's a third, rarer pattern worth knowing simply because it exists: a sweet, slightly musty breath, sometimes described almost like the smell of a freshly cut apple gone slightly wrong, has historically been associated with advanced liver dysfunction, a pattern doctors have referred to for a long time as fetor hepaticus, caused by certain compounds the liver normally filters out, building up instead. None of these are things to self-diagnose from a video, and I would never suggest otherwise, but they're also not things to quietly notice and let slide for 6 months. If a smell shows up that doesn't match anything in your own history, sweeter, sharper, or stranger than your usual bad breath day, that belongs in a conversation with a doctor the same week you notice it, not eventually. There's one more layer, rarer than everything above it, but worth knowing simply because it exists: chronic lung infections or long-standing conditions like bronchiectasis, where mucus builds up and pools in damaged areas of the lungs, can produce a persistent, foul-smelling breath that has nothing to do with the mouth, sinuses, or stomach at all. It's uncommon. It's also the kind of thing that, paired with a chronic cough or recurring chest infections, deserves a direct mention to a doctor rather than years of guessing. Now, why doesn't any of this respond to mints, and why does that matter practically? Mints and most mouthwashes work by introducing a stronger, more pleasant smell at the surface level, the exact same surface level your toothbrush already reaches. If the actual source sits 4 millimeters below your gum line, behind a bridge, inside your sinuses, or originates from your stomach or bloodstream, a burst of spearmint has no real way to compete with that. It's a bit like painting over a patch of rust on a car door. For a little while, the surface looks fine. The rust is still spreading underneath, completely unaffected by the paint, and it'll show through again soon enough, usually a little worse than before. This is exactly why so many people end up stuck in a frustrating loop: brushing more, buying a new mouthwash, picking up a tongue scraper, maybe cutting out coffee or garlic for a week, and the smell barely moves or comes back within days. It's not that the hygiene is wrong. It's that hygiene was never actually the lever for the specific problem they have. So what helps practically without turning this into months of guessing? Start with a dental visit specifically aimed at ruling out gum disease. Not just a routine cleaning, but an actual periodontal exam where pocket depth gets measured around each tooth. That single step eliminates or confirms the single most common cause almost immediately. While you're there, ask specifically about any crowns, bridges, or older fillings, since those margins are easy for a dentist to check directly, but easy for you to miss entirely on your own. If the dentist clears all of that and the smell persists, the next step is widening the search rather than repeating the same hygiene routine louder. An ENT can evaluate sinus drainage, tonsil stones, and airway issues tied to mouth breathing or snoring. A doctor can evaluate reflux symptoms, request blood work that would flag blood sugar or kidney function if either is relevant, and ask the kind of specific questions that actually narrow things down: when it's worse, what it smells like, whether it changes after eating, after lying down, or specifically in the morning. A doctor working from "I have bad breath" has almost nothing to go on. A doctor working from "it's worse in the morning, sour smelling, and I've had some reflux symptoms at night" can actually move toward an answer quickly instead of guessing alongside you. If you've noticed any version of this in someone you live with, a partner who's started turning their head slightly, a parent who's been offered one too many mints by people clearly trying to be polite about it. It's worth mentioning to them gently, not as criticism, but as information they may not have access to about themselves, because none of us can smell our own breath the way the people around us experience it. That blind spot is universal, and it's exactly why this tends to go unaddressed for years in otherwise health-conscious people. There's a fairly ordinary version of this story worth picturing for a second, because it captures how quietly this usually unfolds. Someone in their late 50s starts noticing the same small social cues: a slight head turn, an offered mint, a coworker's habit that feels just a touch too consistent to be random. They assume it's hygiene, so they upgrade their toothbrush, switch mouthwashes twice, start carrying gum. Nothing changes. Eventually, almost as an afterthought, they mention it to their dentist during an unrelated visit, expecting to hear, "Just brush a little better." Instead, a periodontal probe finds pockets measuring several millimeters deeper than they should be around two back molars, painless, invisible in the mirror, completely missed by every toothbrush pass for years. The fix isn't dramatic. It's a deeper cleaning, a referral to a periodontist, and within a few weeks, a smell that had quietly outlasted 3 different mouthwashes simply stops being there. Nobody mentions mints anymore. Nobody turns their head. The person never even fully realizes how long it had been going on, because by the time it's gone, it's almost impossible to remember exactly how it felt while it was still there. That's usually how these things end, when they end well, not with a dramatic diagnosis, but with one specific overlooked spot finally getting looked at directly. The smell was never the actual problem. It was just the only signal loud enough and persistent enough to eventually get noticed. Breath isn't trivial, even though it gets treated that way constantly. It's one of the few signals your body produces involuntarily, continuously, and honestly, often well before any lab test would catch something useful. The real difficulty is that it's also one of the easiest signals to mask instead of read, simply because you can't smell yourself the way the rest of the world does. That gap between what you experience and what everyone around you notices is exactly where small, fixable things sit quietly for months, sometimes years, getting slightly worse, slightly more resistant to mints, slightly harder to explain away, until someone finally says something out loud, or you finally ask the right question in the right office. If this is the kind of thing you want walked through again, the small overlooked signals your body sends before anything dramatic ever shows up on a test. Subscribing now means you won't lose this thread once it slides further down your feed. And if one of these specific causes matched what you've actually been noticing, say which one in the comments. It genuinely shapes what gets covered next, and it tells me more about what's common right now than any general list could.